welcome on a Saturday morning. Thank you very much for giving up your time to come to this workshop. My name is Nicola Davis and I'm one of the medico-legal advisors for MIPS. I'd like to also introduce you to Melissa Maitland-Smith, who's one of our membership officers here in Queensland. So we're talking about beyond negligence, your professional risks, and the reason we started this workshop was because when we were doing other workshops with members, we found that people wanted to know a little bit more about how MIPS works and how the complaint system works. Obviously really important to look at preventing these things, but people wanted to know the processes and how MIPS is involved. And so we're going to do a little bit of information session combined with looking at how we can reduce these risks and handle them. This is very much a workshop. I'm a facilitator, and so I'm aware that there's a huge amount of knowledge in the room already, and so it isn't my intention to just read off lots of slides. There's some workshopping of cases, but please look at any stage. If you've got a story or disagree with something or want to put a point of view, please do just put up your hand or yell out. So my name's Nicola Davis. I'm actually a GP in North Queensland. But I work 3 days for MIPS, so along with two other medico-legal advisors in Queensland, we take the kind of calls on the shop floor and obviously handle the matters after that in liaison with the other medico-legal advisors. I also work for JCU, James Cook University, up in Cairns, looking after the Year 4 students we've got there. So look, just a little bit of summary of what we're going to look at. As I mentioned, current trends for health practitioners. So obviously we've had mandatory reporting since July 2010. We're just going to have a look at what's happening there and how that has impacted, and obviously a little bit of information about the boards, which some of you will know, that the dental boards and medical boards and the background, but where you can find out some more resources should you wish to. And then have a look at the personal professional risks that currently we find that doctors and dentists are experiencing, how we can help from indemnity, and obviously other areas of risk too that you may not have thought about or come across that are just a little bit more curly ones, and then obviously to case study how to mitigate these events once they're reported. So as most of you would know, the tort law reform in Queensland has had a bit of an impact on the frequency of claims, and so certainly claims are getting sorted more quickly, and there has been a reduction in the claims certainly that are progressing. Things kind of have much tighter timelines, and that we do find still that people can appeal those timelines and they go through. But on the whole, the impetus is certainly out there in the legal world too. They're very much aware that if someone comes to see them, they've got to make a decision whether to progress it. But we are seeing an increase in disciplinary matters and complaints. And so of the calls that I take in a week, an enormous number of them are complaints either at a regulation body level or obviously patient complaints direct to the practitioner. So people are complaining more. I'm sure that doesn't come as a huge surprise, and they're complaining more to the board. And as you know, in Queensland, we've got this sort of transitional board situation at the moment. Things seem to be fairly much business as usual from our point of view in the decision making, and possibly what it does seem to be that things are getting processed a little bit more quickly at the moment. But the complaints, the medical board are interested in pretty much anything and will respond to everything. They're not doing kind of flicking things to other bodies maybe in the same way they used to some years ago. And look, the one thing that comes out as to why this is happening is because, as I don't need to tell you, we're all extremely busy, and possibly our communication is at times, because of that busyness, becoming an issue. And certainly in the complaints that we're seeing, nothing new there. That's been there for 20 years. All the data has shown that communication is the thing that loads the gun. So perhaps may be aware of studies over in the States where people have said actually that even before they had a procedure done, they were thinking of suing the doctor. So nothing had actually gone wrong yet, but they were so kind of turned off by the consultation that had already set in their minds that they were dissatisfied. Now, obviously, the people who come to workshops such as this are in a group that are less likely to be sued. And I'm sure if I said to you all, you know, look, how's your communication skills, you'd all have great communication skills. And the things that I find that have happened in my practice and when people are telling you stories is obviously nobody intentionally communicates badly nowadays. We've all had lots and lots of training in that. It's just those moments where maybe something else happens. So, you know, you ask a patient to come into your room and maybe someone phones you about the billing of the last patient, or the last patient forgot something, and you obviously attend to that, and perhaps that just sets you off on the wrong foot because you haven't made the eye contact, you haven't done the introduction the way you normally do it. And so I guess it's the emphasis is noting when our communication falls down. The last time I had a complaint against me was about 10 years ago, and I deserved that complaint. Our dog had been run over. Fortunately, it was okay, but I was at my GP surgery and trying to organise for this dog to get to the vet and get sorted out. And in one consultation, I actually had 10 phone calls. And I should have, and perhaps my practice staff should have said, well, look, Nicola, you should go home and sort this out. Let's just cancel the patients. But, you know, ploughed on as we do. And quite rightly, the patient who had the 10 phone call interruption got pretty annoyed and wrote me a letter afterwards saying that he thought it was pretty unsatisfactory, and indeed it was. It took a little while, obviously, to acknowledge that and apologise and kind of build back that relationship. So that's an extreme example of kind of when our communication skills sort of, we've got to identify when it's happened. So how are we regulated? And we're regulated by national law. All health professionals are. So AHPRA, the Australian Health Practitioner Regulation Agency, actually look after all health professionals, and they keep adding health professionals to that. And apparently 1 in 39 Australians is a health professional now. So they're looking after 1 in 39, or looking after is perhaps being a generous description. So a large proportion of the population. It's a big organisation. And I think, look, it's maybe obvious to some, but it's important to state what is their mandate, what are they about? And they are about protecting the public, okay? They're about ensuring that we are competent and, interestingly, so this is a direct quote for them, competent and ethical. Some people might say, well, you know, do we have to be ethical? And ethics vary. My ethics might be different from your ethics. So that's where it gets complicated and interesting, isn't it? And perhaps my fourth-year medical students have different ideas of ethics than I do. And so, but it's there, plain and simple. And so if you have this kind of attitude, well, look, you know, it's just a job. I go there, I'm competent, and I do my job and go home again, fair enough. But the board are expecting us to be ethical and numerous other things too that we'll refer to. And that's just the rules, I guess. So probably not much point. We can debate whether the rules are a good idea, but at the moment that's... and I spend a lot of time talking to doctors about, sorry, these are the rules, because quite rightly people get upset if they have different ethics or different points of view. The other thing people sometimes get upset about is if they report themselves to AHPRA, which is a very good thing to do. It's always better to report yourself to AHPRA than have someone else do it. And quite often we'll actually say to health professionals, you know, doctors or dentists who are wanting to report a nurse or another health professional, how about you give the patient the opportunity to report themselves for 24 hours and say you'll do it tomorrow, providing there's no ongoing risk. Because it makes a huge difference to AHPRA because it shows insight that you've been willing to do that. But when people do report themselves to AHPRA, for instance, perhaps over an episode of having been off work with depression or something like that, sometimes get a little bit upset when the letter comes back because it isn't very warm and fuzzy. It basically says, hi, welcome, do come in, sign in, come in. The letter's not normally very warm and fuzzy at all. It isn't, you know, dear Dr. Davis, I'm sorry to hear you've been having a bad time and I hope you're feeling better. It usually says, righto, we need permission to speak to your doctor. we need to get your medical records, and to be honest, they don't need your permission to get your medical records or anyone else's. And we'd like you to see an independent practitioner of our choosing to get assessment. And so understandably, people get a little bit upset at what they perceive as a bit of a fierce attitude. And so it's just important to have in the back of your mind that it's all about protecting the public. It's not about supporting us, I'm afraid. Anyone got any questions so far?
Yeah. How often would it happen that someone reports themselves to APRA, in your experience?
Quite a lot, actually. Look, it happens more often that we suggest that they report to APRA, and even more that a practitioner who's phoning us, we tell them to suggest the person reports themselves. So spontaneously reports to APRA, I don't have a figure, I'm afraid. It would be a very interesting figure, but it's quite a small percentage, I suspect. But APRA, I have got some APRA figures, but I haven't got that one. It would be good to try and hunt that down.
What would be the reasons for
Well, people have different levels of reporting. It's fascinating. I mean, some people will, if they go and see a psychiatrist about a depressive episode, some people would report that themselves. I mean, obviously we're obliged to report, and on your renewal form it says that you have to report anything that's going to have a significant impact on your practice. And that's obviously very open to interpretation, because some people will say, look, I'm depressed, but I've got a handle on it, I'm getting treatment, and I don't need to report it, and we would, I think, be able to support that. Obviously, any type of addiction, it's pretty hard to argue against. You know, we sometimes have doctors that say, look, I drink a lot of alcohol, but I only drink at night. So I'm fine in the day, I'm not on call, so it's not really an issue. Or have a patient with that, and that's a difficult one. So, and then there are people who've had terrible things happen to them who obviously haven't reported them. And they're our most worrying customers, obviously. Any other points about that one? Do we come back to that one? So, look, obviously it is hard to know what are the rules. Yes, ethics, so we're supposed to be ethical, but as we've said, ethics vary. So the rules are written down in the Code of Conduct. And I actually last night had a look at the Dental Code of Conduct, because I hadn't, for some strange reason, had a look at that. And I think it's exactly the same as the medical practitioner's one, in fact. And so the Code of Conduct, which is on the Medical Board's website, is quite an interesting document. I try and get my students to have a look at it, because it really reaffirms that the Medical Board expect a lot more from us than just being competent. They expect us to be professional with colleagues. So it's not the done thing to run down your colleagues. They expect us to look after the health service in general. So you know those patients who come in, and I have them all the time, who want me to tell the hospital that they're a Category 1 where they're clearly not a Category 1, and I explain to them that I'm not going to tell the hospital they are, because I'd look silly, and it's not ethical. I now actually could refer to the Code of Conduct and say, actually, there's another reason I can't. I'll get into trouble with the Medical Board if I pretend that you've got something. So there's all sorts of expectations in there. Has anyone had a look at it, Code of Conduct? Yeah. It's quite interesting to skim over. So, look, the other thing is that the word of notification is an important one. Okay? We are just often notifying the board. I often have doctors that are in terrible turmoil about whether to report a colleague. And I guess, look, the commonest one is a colleague maybe in their practice. You know, someone they're going to have to work with, someone that they have at times had an awful lot of respect for and still do, but they've got concerns about certain actions that maybe happen on a repeated level, and they're kind of in turmoil as to whether they should notify. And I say to them, look, it is a notification. You're not deciding whether this person's fit or not. You are merely saying some facts, and it's up to someone else to decide. The medical board will decide whether that person is appropriate to practice. Know that that's not as simple as it sounds, but it sometimes I think does help a little bit.